It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
Oh, this here, it's not just a mask, it's more than a mask.
It's a message.
It's protection for our families.
This mask doesn't silence my voice, it saves lives.
Defeating COVID-19 is about more than a mask.
It's about making change.
It's about us helping us.
We're going to give you more than a mask.
We're going to give you facts, tools, inspiration.
If we're going to beat COVID-19 in our communities,
we're going to need a mask and more.
The world is waiting. It's waiting for new ideas, waiting for new solutions, waiting for the next big breakthrough. But scientific discovery takes time, you say. So many possibilities to explore and countless dead ends. If only we could get there faster, which is exactly why CAS is here. Specialists in scientific information. We extract and analyze the world's scientific data so you can build upon the right discoveries. We provide the insights only expert scientists can deliver, so you can leverage new approaches for faster results. And we put big data within arm's reach, so progress isn't just something to be desired, it's expected. That is why we do what we do. To ensure the innovators of the world, like you, are able to meet the greatest needs the world has been waiting for. Together, we will do great things.
It all began in the year of 2020.
When a virus, better known as COVID-19,
changed our lives and devastated our communities.
COVID-19 has impacted our jobs.
Our children's ability to go to school.
Our ability to socialize and gather with our loved ones.
And prevented us from worshiping at our faith institutions.
And we already knew that healthcare disparities existed.
This pandemic has highlighted just how much of a disparity exists as it relates to people of color.
Did you know that thousands of people die every day of COVID-19?
As people of color, we are more likely to get COVID-19.
More likely to be hospitalized.
And we are most likely to die.
As people of color, we are more likely to work in essential jobs.
And many of us live in multi-generational households, which increases our risk of the virus.
We are dying
and burying our loved ones at a much higher rate as compared to other racial and ethnic groups.
We have to make a change.
Although we face such adversity, we are a powerful and resilient community.
The COVID vaccine is now available and is an effective weapon to fight this virus.
This vaccine provides so much hope for the future.
Did you know that a Black scientist was crucial to the development of the vaccine?
As a matter of fact, there were several Black scientists who were on the FDA advisory committee who heavily scrutinized the vaccination before it was widely distributed.
Did you know that thousands of people of color were included in the clinical trials to test the safety and the efficacy of the vaccine?
People that look just like you and me.
Now, I understand that you may be hesitant to get this vaccine, because I was too, until I did more research.
It's so important that you review credible resources when making a decision about this vaccine.
We understand. The healthcare system hasn't always been kind to us.
We remember the Tuskegee experiment.
And we remember Henrietta Lacks.
We know the history of our healthcare system.
But we have made so many advances since then.
And people of color are in key decision-making roles.
As Black physicians, we are our ancestors' wildest dreams.
We went into medicine to advocate for you,
to educate,
to counsel,
to heal.
Please, follow our lead.
When you make the choice to get vaccinated, you are not only protecting yourself from a serious illness,
you are protecting your family,
your friends, your entire community.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated. And we hope that you will too.
African Americans have been disproportionately affected by the COVID-19 pandemic.
Yet, white Americans are 2 times more likely to get the vaccine than African Americans.
It's time we protect ourselves, our families, and our community.
You have a right to feel skeptical, but our mental and our physical well-being is at stake.
Get vaccinated.
Get vaccinated.
Get vaccinated.
Get vaccinated.
Get vaccinated.
Get vaccinated. Let's end our anxiety from the pandemic.
Our mental well-being depends on it.
If you would like help finding a vaccine location near you, please call us at 937-443-0416 or visit us online at mcadamus.org.
Remember when we were young and our parents took us to get vaccinated? Well, now it's our turn to help them, because the COVID vaccine is available for older Ohioans. The vaccines are safe, effective, and have been rigorously tested. It will take time to get people vaccinated, but it's the best way to protect our health and help Ohio on the road to recovery. Learn more at coronavirus.ohio.gov. We can all make a difference.
It's okay to feel a little anxious right now.
It's okay to be sad, lonely, or confused.
It's okay to feel angry or like you've lost control.
And it's okay to ask for help. Ohio's CareLine is an emotional support hotline staffed with behavioral health professionals. It provides free confidential assistance to help navigate these uncertain times. It's okay to not be okay. With help from Ohio's CareLine, there is hope.
And so it begins. The road back to the way things used to be here in Ohio. The vaccine we've all been waiting for has finally arrived.
It's safe.
It's tested.
And it works.
Right now, we're rolling it out to Ohio's most vulnerable seniors. But our journey's just beginning, and we need your help.
By continuing to social distance and wear a mask. Until we're all protected and back to the way we remember.
There are a lot of questions right now.
questions about our new normal, about how to unite a country divided and find equality for all. Tough questions, but here in Ohio, we've always been pretty good with answers. It's 1903. The whole world is asking, is it possible to fly? Ohio says, we've got two brothers we'd like you to meet. In '69, our country asked, who will take one small step for us? We've got the man for that. How do you make machines that move us? Machines we cheer for. How do you start a movement, make peace, honor rock and roll, come back down 3-1? How do we recover from a global pandemic unlike anything we've ever seen before? Ask Ohio. We'll show you.
It all began in the year of 2020,
when a virus, better known as COVID-19,
changed our lives and devastated our communities.
COVID-19 has impacted our jobs,
our children's ability to go to school,
our ability to socialize and gather with our loved ones,
and prevented us from worshiping in our faith institutions.
And we already knew that healthcare disparities existed.
This pandemic has highlighted just how much of a disparity exists as it relates to people of color.
Did you know that thousands of people die every day of COVID-19?
As people of color, we are more likely to get COVID-19.
More likely to be hospitalized.
And we are most likely to die.
As people of color, we are more likely to work in essential jobs.
And many of us live in multi-generational households, which increases our risk of the virus.
We are dying and burying our loved ones at a much higher rate as compared to other racial and ethnic groups.
We have to make a change.
Although we face such adversity, we are a powerful and resilient community.
The COVID vaccine is now available and is an effective weapon to fight this virus.
This vaccine provides so much hope for the future.
Did you know that a Black scientist was crucial to the development of the vaccine?
As a matter of fact, there were several Black scientists who were on the FDA advisory committee who heavily scrutinized the vaccination before it was widely distributed.
Did you know that thousands of people of color were included in the clinical trials to test the safety and the efficacy of the vaccine?
People that look just like you and me.
Now, I understand that you may be hesitant to get this vaccine, because I was too, until I did more research.
It's so important that you review credible resources when making a decision about this vaccine.
We understand the healthcare system hasn't always been kind to us.
We remember the Tuskegee experiment.
And we remember Henrietta Lacks.
We know the history of our healthcare system.
But we have made so many advances since then.
And people of color are in key decision-making roles.
As Black physicians, we are our ancestors' wildest dreams.
We went into medicine to advocate for you,
to educate,
to counsel,
to heal.
Please, follow our lead.
When you make the choice to get vaccinated, you are not only protecting yourself from a serious illness,
you are protecting your family,
your friends, your entire community.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated. And we hope that you will too.
It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
Good evening. I'm Marcia Bonhart, and welcome to the Ohio COVID-19 Town Hall Vaccine. We are so pleased to have you with us this evening. This is an opportunity to get information about the COVID-19 vaccine, to clear up any questions or any misconceptions. As the slide said, as you read, it's normal to have questions about the vaccine. Well, tonight we have medical experts, we have members of the faith community, we have trusted community leaders. They are all here to give you as much information as possible about the vaccine. Tonight, the focus is going to be to educate African Americans. In fact, recent news headlines have told us that more than 2 million Ohioans are not planning to get the vaccine. And in that group, a majority, a great percentage, African Americans make up a great percentage of that group, expressing a lot of different concerns. Again, as you saw on the slide, it's normal to have questions. So tonight, hopefully, everyone will be able to clear up any misconceptions, any questions, anything that you might want to know, hopefully will be cleared up this evening. And so we're so very happy that you're here with us. Right now, we want to say thank you to the sponsors. These are the folks who have helped to make all of this happen. Thank you so much to CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, the Ohio Latino Affairs Commission, the Governor's Office of Faith-Based and Community Initiatives, and the Appalachian Ohio Commission. Now, just before we start the questions, we'd like to hear from Ohio's Governor, Mike DeWine. Governor?
Well, Marcia, thank you very much. And first of all, I'm not an expert, but I'm looking at the panel and the group that you have coming up, and there's some real experts on there. So I just wanted to say good evening to everyone. Thank you for joining, and just a couple quick comments. We have been battling this for almost now a year, and it's hard to believe. But I'm very hopeful and I'm very optimistic. And one of the main reasons I'm optimistic is because we now have the vaccine. We're on offense. I love sports. I wasn't very good at sports, but I love sports. And being on offense is always better than on defense. But I know that many people have some significant reservations, concerns about taking the vaccine. And so that's really what this is about tonight, to hear from some experts who really understand the science behind these vaccines. Fran and I had a wonderful experience yesterday. We had the opportunity, we went over to Dayton, Thurgood Marshall High School, and the community had come together, working with the mayor's office, our office, a number of different churches, to have a vaccination site there. And Kroger actually did it. And, I think there was over 1,500 people were vaccinated just yesterday there. And we had the chance to walk around and just talk to the people who had been vaccinated. And it was one of the most inspiring things and uplifting things I've seen, because the individuals who were there were they felt good. They were optimistic, and, they told us things like, I can go hold my grandchildren after I get through this, the vaccines, or I can go to a baseball game, or I can do any number of things. But it was just the relief that you saw. And so I hope that, you'll take away from tonight the science behind this, and listen to some of the folks who really understand what is going on. And I hope you'll be willing to take the vaccine. My commitment is to make sure that everyone in Ohio has access. This is an individual choice, obviously, but we work every single day to try to do a better job. And it's a work in progress, but to try to do a better job to make sure no matter where you live in Ohio, no matter who you are, no matter what your circumstance, you will have a real opportunity to get this vaccine. We believe in equity. We work towards it every single day. And so that's our commitment to you. So I'm going to stop and turn it back to the experts. And I said, you've got a great group of people who are coming here, and I hope you enjoy this evening and have the opportunity to hear from them. And we appreciate you tuning in and being on. Thank you very much.
Right. Thanks so much, Governor DeWine, for those words. We are ready to start with our first question. And with this question, we're going to address Dr. Sophia Tolliver, family medicine physician serving vulnerable patient populations in Columbus, and Dr. Leon McDougall, president of the National Medical Association and chief diversity officer with the Ohio State University Wexner Medical Center. Dr. Tolliver and Dr. McDougall, our first question: what is in the COVID-19 vaccine, and how was it developed so quickly? And why is there more than one kind of COVID-19 vaccine? Dr. Tolliver, would you like to start, please?
Sure. Well, thank you for having me. It is a pleasure and a treat to be here tonight. So the COVID-19 vaccine is comprised of several ingredients. We have lipids, also known as fats, salts, sugars, messenger RNA, a combination of ingredients meant to help transfer the messenger RNA to cells in order for that immune response to take place. In terms of the next question, which was, let me remember that, how was it developed so fast? So I think this is one of the questions that we get often from our patients. I think it's a point of concern and contention for our patients that we've been in this pandemic for about a year or so. And how did this vaccine get developed so quickly? Is it safe? Should I take the vaccine? And we can say that the science, the research behind the vaccination is at least 8 to 10 years old. And we know that coronaviruses, of which there are hundreds, have been studied for the past 50 years. Specifically for the adenovirus, the MERS outbreak, that was several years ago. Scientists, researchers were doing research on that virus, which is a coronavirus. And so there was already a groundwork in place. There was already science and data in place so that when SARS-CoV-2, which causes the COVID-19 infection, came about, we weren't just starting from scratch. And so they were able to take that information and develop the necessary vaccines. And that's sort of where we've come to the landscape of vaccinations that we have at our disposal today.
Yes, and Dr. Tolliver did an excellent job of explaining that, and I'm in full agreement with her. And the process involved did not take a shortcut on quality. There has been robust oversight. It was spoken to earlier in how the FDA included members such as Dr. James Hildreth, who is the president of Meharry Medical College and a virologist. He was part of the FDA oversight team. The National Medical Association convened a COVID-19 task force to review the data submitted to the FDA for emergency use authorization. And our task force is comprised of NMA members who are infectious disease specialists, pediatric infectious disease specialists, infectious disease epidemiologists, public health officials, and the like. And we met personally with the scientists from Pfizer and Moderna, the developers of the currently available messenger RNA vaccines. We're also meeting with AstraZeneca and Johnson & Johnson, who are developing vaccines with the adenovirus platform. So we released an advisory statement on the Pfizer and Moderna vaccines on December 21st. And I would ask that the audience members take a look at that advisory statement. We investigated the vaccines from the perspective of Black doctors serving the Black community, and we did not see significant difference in outcomes when comparing the Black cohort of participants to others. And as you may know, there were about 10% of the enrolled participants in the clinical trials who were Black, and equaling about 4,400 people for the Pfizer study and about 3,000 for the Moderna study. So with reviewing the data, talking with the scientists, we are in support of the FDA emergency use authorization of both vaccines.
Dr. McDougall, thank you so much. And Dr. Tolliver, thank you so much. There was one question that sort of was answered, but not fully, and hopefully we can come back to that a little later, but we're going to move on now to the second question. And now we are introducing the president of the Ohio NAACP and a former state senator, Mr. Tom Roberts, and the president of the Southwest Ohio Urban League, Mr. Eddie Cohen. Gentlemen, thanks so much for being with us and joining us this evening. This question that I am directing to you is, which is the best source of information on the science of COVID-19 and the vaccine itself?
Well, for me, thank you, Marcia, for the question. I don't know if it's from Eddie or me, but I'll start. There are multiple sites. I would begin with the Ohio Department of Health website, which has great information. And then your local Department of Health websites have great information that individuals need to be looking at. And as the two doctors said before, NAACP at the national level has been educating us since day one on the COVID vaccine and the virus. So we've heard from national speakers on this issue. We also have been doing some town hall meetings locally, and hopefully I'll have a chance later on to share with you that we will be hosting local train-the-trainer sessions where NAACP, working with the Ohio Department of Health, will be training local leaders to help educate our communities. And beginning, I think the second week in March, we'll begin those train-the-trainers. So I would say the health department's websites, and there are also people like the two doctors in our communities, along with our units that have been doing these town hall meetings.
Are there any others that you may be able to add? Mr. Cohen?
Yeah, thank you. Thank you so much, one, for having me here. I would echo what my friend Tom said. You know, coronavirus.ohio.gov is a site that we use. If you want to do something that's non-domestic, the World Health Organization, WHO.it. But really, you know, when we think about the Herculean task of trust, there are organizations that have been here in the community for you that are helping to interpret some of this language, like what is congregate living, right? Closing the Health Gap, I have to send them a shout out. They created a website, COVID-19communityresources.com. It's with us, the NAACP, Councilwoman Jan Michelle Kearney, and we're in contact with the local health department, Commissioner Moore, for a one-stop shop for people to be able to access information about the science. You know, one of the things that we also tell people is now we know people who have gotten the vaccine, right? Ask them, right? It's hard to share something that is misleading when you actually know someone who is living, breathing, and is well after getting the vaccination.
Gentlemen, thanks both of you. I think we have the information, and if there's anyone who's interested, who needs the best source of information, you have certainly led everyone to some great websites, some great information. Thank you. I'd like to now introduce Pastor Jerry Revish, who is pastor of Unity Temple Church of God in Christ and recently retired anchor, and may I add, news icon, recently retired journalist. Thanks so much for joining us. You know, there's been a history of fear, a history of, we can even perhaps use the word abuse. So Pastor Revish, how can minorities be expected to trust government and the medical community to take the vaccine?
Thanks so much for having me tonight. You know, it's about trusting the science and trusting the facts. There's a lot of great information out now about the vaccine. I remember talking to my congregants when we first heard that the vaccine was going to be available soon. And my thought was then and now, I want you all to get vaccinated. And I didn't get the complete buy-in that I wanted to from them at first. I was kind of startled at that. There were some people that were really reluctant about taking this vaccine. And of course, we know the history of Black people in medicine, the Tuskegee experiments, and even before that in slavery days, there was a lot of experimentation done on our people. And then when you think about the fact that we don't always get opportunities to get great medical care, there's a lot of skepticism going on amongst people. So I think what we have to go back to is, what do the facts say? What does the science say? As those that have gone before me tonight have spoken eloquently about how this has been a tried and tested vaccine. It's been looked at all sorts of different ways. And the government was very deliberate in deciding whether to endorse it and approve it. So I think we're now sort of turning the corner. In some ways, I'm seeing some vaccine envy among our members, because now some are getting vaccinated and others are asking, well, where did you go? I haven't been able to get any response from the places I've been calling around. How did you feel after you took it? And as we heard earlier tonight, people are talking about their own experience with this vaccine. So we've got to continue to let them know it's for your benefit and for your home's benefit and for your loved ones' benefit. We're coming up on 500,000 people dead. It's just unconscionable and incredible to think of that. And this is the only answer to this virus right now, is to get vaccinated. So my hope is that as we continue to go along, it'll get better.
Well, let's talk about the church, and that you bring that up, your congregants. That is a prime location, would you say, to encourage people who are concerned about the vaccine? I mean, the church, after all, is the seat of information for centuries for African Americans. So you really have a great responsibility there with your church.
We do. And as I was talking to them about the vaccine, I said, you know, we were praying for a breakthrough. We were praying for a solution here. All right, now we have one. Our prayers are being answered, and we need to step up and take this vaccine. We can't think that medical treatment is in some way not having faith. It's part of God's grace to us, giving us this opportunity to have these kind of breakthroughs. He gave man the know-how to come up with this vaccine. And it's an opportunity for us to take advantage of that, which is in front of us. When you look at the Bible, that Samaritan, that good Samaritan, what did he do? He helped bind up the wounds of that guy that was robbed and jumped, bound him up and poured in oil and wine into his wounds to help him. That was like he was a first responder. This was first aid being given to this Samaritan. So if you look at that, sort of speaking metaphorically, right now we've got something that I believe Providence has given to us. I think it's something that God has given man to do, given him the know-how to do that, and we should take advantage of it. We want to see everybody. You know, the church has been hit very hard. There are many denominations, mine in particular, have lost so many bishops and mothers in the church and pastors because of the whole notion of church life. It's a close-in kind of existence. You're in a pew with other people. You're going to a funeral. You're around other folks. You're hugging, you're shaking. All of that is part of what we do. And now we've not been able to do that. We've had to pull away from all of that. We don't do much in-person church anymore. It's all live streamed. And that's hopefully going to turn the corner here soon for people to be able to get back into a sense of normality about their church life. And I think it's a step of faith certainly.
Yes.
But it's
Thank
a
you.
step of faith that's also bolstered with science and facts.
Absolutely. Thank you so much. And I'd like to present that question to Mr. Roberts and Mr. Cohen in terms of you, the two of you being community leaders. When we talk about the past of healthcare disparity and the Tuskegee experiment, how do you combat that within your individual communities? What do you say to the African-American community? How do you present this to them, given healthcare disparity for years and years and the Tuskegee experiments?
Well, Marsha, for me, I think you acknowledge the fact that the Tuskegee experiment was a tragedy and it went on for years without being corrected. And there still are inequities, and we have to admit that in the healthcare. And that's one thing that this pandemic has taught us, of the inequities in the healthcare industry and the education, so many others. But I think once you explain that that is happening, we have to get to, as the doctor said, the science. To me, I'd rather be 6 feet apart than 6 feet under. And that's what we have to get people to see. That's what this is all about. You know, and I think the theme is to wear the mask. I think that's what we have to get people to understand, that all of this is in our best interest. We want to live a long time, but this is one of those rare moments in our history that these kinds of things will exist. But so we have to follow the science. And that's what we've been saying as NAACP from day one. As I said, our national has taken a lead on this. Many of our units have been doing this at the local level, educating our individuals, but we must follow the science, because this is a deadly impact in our community, and people of color are dying because of it. So we have to be serious about how we address it. Eddie?
Yeah, and I agree with Tom. I would lead by saying, first of all, it is impossible to reestablish complete trust in a matter of months when it has been rooted in centuries of distrust. So we have to start on that premise. It is, however, possible to mitigate that situation. When we look at the surveys that organizations have done over and over, 67% with the Closing the Gap survey that they just implemented in the community, people are afraid of the side effects of COVID. Even anecdotally, we know the number one question when people have gotten vaccinated is, how do you feel afterwards, right? Again, if I know Marsha and she's gotten vaccinated, you know, the speed of trust is quicker. It accelerates my willingness to take the vaccine. Again, I don't have to compare that to a viral video that I see from someone who I don't know. But, you know, Marsha, the question isn't whether or not the government is worthy of trust. The more appropriate question to me is, do Black people, do we deserve equitable access to the vaccine and the right to live? So we have decided to push there. We can see the data already, the disparate impact that have received the vaccine versus those who have not, and eyebrows begin to raise. So we continue to push because we don't want this narrative. If you look back 4 months ago, back in October, versus where we are 4 or 5 months ago versus now, attitudes are changing pretty quickly as we see more people who look like us, who are proximate to communities, who are getting the vaccine. And I think if we strategically use those who have agency and trust, we will see an adoption of people getting the vaccine faster.
I think when you said we have the right to live, that phrase is extremely impactful. And if you just present that to people and just say, do you have the right to live? Just that one question. Thank you both, gentlemen. We want to know, is the vaccine safe, and how is its safety being monitored, and the potential side effects of the vaccine? I'd like to introduce Cincinnati Health Commissioner Dr. Melba Moore, and I'm going to ask our medical leader panelists, Drs. McDougall and Tolliver, to join in after we hear from Dr. Moore from the Cincinnati Department of Health.
Good evening to my fellow panelists, and Marsha, good evening, and thank you for this opportunity. Is the vaccine safe? Yes, it is. We have heard from our physicians on the panel about vaccines and the process. But I think most importantly, what I want to draw everybody's attention to is the fact that 10% of the participants in the study were African American, people of color. And think about in the city of Cincinnati, we had the study going on in the city of Cincinnati. It is safe. Listen to those trusted voices. You've heard President talk about those trusted voices in the community. But push the reset button. Find people within your own circle. Remember earlier this year, we talked about our bubble. Within your bubble, who's had the vaccine? Talk with them. We've heard earlier, research, read the research. And most importantly, is what we're doing tonight. We as professionals, as healthcare professionals, healthcare providers, in that doctor's office, I can only imagine Dr. Tolliver spending a moment talking with her patients. And Dr. McDougall talking with the patient. That's what we need to do here. Have this conversation, answer the questions. We all talk about transparency. Answer the questions and provide that understanding to bring people along. That's what we're here for, and that's what we do.
Thank you, Dr. Moore. Dr. Tolliver, I'd like to ask, in your work with the most vulnerable populations in this state, how do you talk to them about the vaccine? How do you encourage them? When you have folks, as we mentioned, there's so much healthcare disparity and then the distrust. What do you say to your population of patients?
So me and Dr. McDougall do a lot of talking to our patients, and oftentimes our patients look like us. And I think that within the confines of an office visit, now being a video visit or a telephone visit, meeting the patient where they are. I like to say Black people have every right to be hesitant about new medical therapies, right? But let's also normalize asking those questions. Let's normalize fact-finding. Let's normalize talking to your trusted professional, your doctor, your primary care provider about those hard questions so that we can relay to you what we found out about the vaccination and the research. Let's have a frank discussion about what your fears are. Let's have a frank discussion about what your past medical experiences might have been, so that we can begin to gain knowledge, so that we can begin to gain accurate facts about the vaccination. Because we want you to, at the end of the day, base your decision for your friends, your family, yourself on facts and not fear.
And may I follow that up with answering a question that you asked earlier in regards to the surveillance. There are a couple of surveillance programs whereby side effects are being monitored. So there's a V-Safe program through the CDC that actually uses text messaging to report side effects. And then there's a vaccine adverse reporting system, VAERS, through the Health and Human Services. So those are two monitoring systems in addition to the 2-year follow-up being required of the vaccine companies. So just wanted to make sure we answered that question, and having that conversation is so important. And that's when we see more compliance, better compliance, when Black doctors are talking to Black patients, because Dr. Tolliver and I, we're having a good time in our office. We are having a conversation. So it's not a top-down discussion. So thank you for that question.
Well, Dr. McDougall, may I ask this question as well? As president of the National Medical Association, which I believe is composed of African-American doctors, has the NMA taken a major stand? Have you done or said anything publicly in reference to the vaccine?
Oh, yes. So I spoke to this earlier. In addition to establishing the COVID-19 Task Force on Vaccines and Therapeutics, which I chair, and I had the opportunity to appoint all these experts, we've joined the Black Coalition Against COVID. Please, audience, refer to that resource on the web. And we've convened town halls and we've engaged leadership ranging from clergy, Rainbow Push Coalition, Choose Healthy Lives, in collaboration with Reverend Calvin Butts at the Abyssinian Church in New York, and the Links Incorporated, who are very strong right here in Columbus, Ohio. I just gave a talk to Jack and Jill Foundation of America. So yes, please refer to our advisory statement that I spoke to on COVID-19 vaccines. All that is available on the web, and please refer to the Black Coalition Against COVID. And we're continuing to convene town halls to have these conversations.
Thank you so much for making it very, very clear. We appreciate that and need that. Thank you so much, both Doctors Tolliver and McDougall. Thank you. Our next question, which are some of the benefits of taking the vaccine, and why should anyone consider taking it? We're going to talk to Pastor Revish, and then later Mr. Cohen and Mr. Roberts. So let's just, what are the benefits? I mean, you might think, well, benefits are obvious, but here's the opportunity to explain them to everybody. Pastor Revish.
Yes, I appreciate that question. As you mentioned, some of the benefits are obvious, but some of them are not obvious. We've been hearing about folks who've needed lung transplants and different sorts of major surgery after coming down with COVID-19. It can be a completely debilitating sickness that would be very difficult to get over, and some, unfortunately, are not getting over that. So you've got to weigh whatever fears you have in your mind about the fact that here is something that is proven to work. You want to be around for, I want to be around for my grandchildren. I want to be around for my congregation. Every single day, we're hearing about somebody who's gotten sick, someone who's died, and we take it personal. Every family has been touched by this, either directly or indirectly. So we have to use the tools that we have now to fight this. And fortunately, now we're seeing it kind of go down. It's not spiking like it used to. And I don't want to try to get into any sort of medical jargon about this, because we've got a lot of doctors here that talk about that. But we're seeing it going down, and that's helpful. That's encouraging. And our quality of life, we want to get back to a normal life. We want to be able to go out and be amongst people and have picnics in the park. And I talk to my folks about that. You want to get back to the things that made you happy and gave you joy in your life. And this is one of the ways, this is the way to get that done for you. And then you don't know who you're around. When we have church, again, we're going to be still wearing masks. We're going to be still taping off every other pew to keep people socially distanced. We're still going to be washing our hands and doing those things that we need to be careful. But we also want to make sure that we work real hard on bringing our lives back to where we want them to be. We want to take back our lives. And this vaccine is one of the ways to get it done.
Thank you. Thank you very much. And Mr. Cohen, just listening to this, Pastor Revish's community is a lot smaller than your community in terms of the Urban League. So your message has to be louder and bigger and greater in terms of why should someone consider taking the vaccine.
Yeah, absolutely. I agree with Pastor Revish, and I think Black people are significantly more likely to have known someone who has died or who has been hospitalized from COVID-19. That is both consistent with local and national data. But I say really at the essence of it, Marcia, is that we embody love radically as a people, spiritually in our lives, and we know what surviving and thriving means. I lost an uncle to COVID, and I lost an aunt during that same time. We have staff members across the state who have lost their mothers and fathers. So when we think about it, it's about protecting the people who we love the most. Our community has been hit the hardest, and that we have a right to live, to go back to those family gatherings, to be able to attend a homegoing service of somebody, to get back to living and being proximate and loving each other like we want to be.
Mr. Roberts?
Well, I can only add that I think what the pastor said and what Eddie said extremely important. It's hard for a person. Death is real, and I don't know what the number is. It was announced today, but it's up there, you know. And some people compare it to deaths Americans at wars. So dying in this pandemic is real, and it's hard for you not to be able to see a loved one. You only be able to touch them through a screen because they're in a nursing home or can't go to a funeral. And so for me, I think the doctor said it best, facts, not fear. We've got to help people understand what the facts are. And I was very excited when I heard early on that Harry and Howard, and I think Southern, were very much a part of the early studies and clinicians going on. So that helped me say to myself and others, okay, this is something that we need to take serious. We need to get vaccinated. I got my first shot a few weeks ago with no side effects. My second one is coming up in a few weeks. And my mother's 95. She got her vaccination first time with no side effects. So for me, we're seeing it happen, you know, and Marcia, you know, there are 10 of us. And so half of us have gotten our shots already, and the other ones are not old enough to get those shots. So we are excited about it, and we're excited about being able to get the vaccination. But I think sharing the information, and this is what I like about this kind of conversation, where the doctors are telling us the reality, and we are people who believe in reality. So
Yes.
I appreciate the opportunity.
Yes, thank you. Thanks to all of you for your comments. I'm going to bring Dr. Moore back, a Cincinnati Health Commissioner, Dr. Melba Moore. There are folks who may be sitting here tonight watching, how do I get the vaccine, and how will I know when I'm going to be eligible to get the vaccine? What can you tell them, Dr. Moore?
Well, I can tell them, number one, you heard Governor DeWine talk about offense. Here in the city of Cincinnati and Hamilton County, community members, we have business leaders, our mayor, our county commissioner, and public health, and several public health agencies are sitting at the table with the hospital systems, the health systems, and planning. And our plan, we developed a website. There's a website where people can go. It's testandprotectcincy.com. And you can click on that link and you'll find a listing of the providers who have the vaccine. And that includes the pharmacies as well, that are out there for people to reach back to them to schedule an appointment. You can call us. You can call 211, which is easy to remember, 211, because we recognized early on in our planning that some people won't want to go to a website. Some people might not have access to that website and that technology. So we wanted to make it very user-friendly for people to have a number where they could call and to receive that information. And on that website, you'll find out if you're eligible. As you know, right now, we're vaccinating the 1B category, those individuals who are 65 and older years of age, as well as individuals who have chronic congenital disorders or conditions, such as sickle cell, asthma, tuberculosis, diabetes, as well as cystic fibrosis. So if you go on the website, testandprotectcincy.com, you have a full array of information regarding the eligibility and how to get an appointment scheduled, or real simple, you can dial 211.
All right, thank you. Thank you so much, Dr. Moore. You know, we are a people of, definitely, we have not had much access to healthcare just historically. So, you know, that we will certainly create some home remedies and do what we can to fix ourselves when we're not well. But I want to talk with Pastor Revish and Doctors McDougall and Tolliver. Any home remedies that you've heard that people are trying to use to prevent them from getting COVID or can take the place of the vaccine?
No, none that are true that I know of. You hear a lot of this stuff. People get on the internet and read something, And you've got to really know what you're reading. You've got to really stick with the science and stick with the facts. The only home remedy I can think of is not being around a whole lot of people at home. You've got to separate yourself out. I remember the holidays, we've all gone through them. This is the first time since I've had children that we didn't have a Christmas dinner together. We just could not do that because of the need to separate ourselves. Even now, when we come around each other, we're wearing masks and we're staying a little socially distant. So there's nothing out there, and I don't see anybody reporting that there's anything out there as far as a homemade remedy or anything like that that is going to help you overcome this deadly virus other than the vaccine.
Well, thank you. And can we get the scientist's word on this? Doctors McDougall and Tolliver, I don't know if you've talked to any of your patients or have heard anything about folks trying to do what they can to keep from getting COVID and perhaps not to take the vaccine. Have you run into any information like that from any of your patients?
So that's a very good question, and I'm going to answer it in a number of ways. There are therapies such as monoclonal antibody infusion for persons diagnosed with COVID and having mild to moderate symptoms. In fact, over 1,000 people at the Ohio State University Wexner Medical Center have undergone that treatment, and we think it has decreased hospitalization rates. So that's an underutilized therapy that's been studied. In addition, there is some evidence that vitamin D deficiency may play a factor in this sickness with COVID-19. Now, I'm not saying, however, let's get this straight. I'm not saying that vitamin D is a remedy. I'm just saying that that's something, if one has a vitamin D deficiency, it may be worthwhile taking vitamin D supplements. So that's what I would like to introduce to that conversation.
And probably just taking better care of your diet and taking better care of yourself, period. I mean, we're not saying that will keep you from getting COVID, but certainly just taking better care of yourself can boost your immune system.
Roger that.
Absolutely, absolutely. I concur with my mentor and colleague, Dr. McDougall. No special teas, no special salves, no homemade plant remedies. Consider some vitamin D in there. If you do get COVID-19, consider the monoclonal antibody therapy. But really, it's going to come down to getting the vaccination and letting the science work.
Well, you know, sometimes the African American community can be very creative when it comes to taking care of itself in terms of health. So we just wanted to make that very clear. Pastor Revish, what about faith? What does faith tell us about taking care of your health, taking care of your body? Is there a biblical link to that at all?
Well, our bodies are the temple of the Holy Spirit, and we have the need to take care of our bodies, both naturally and spiritually. I think we have a situation where we've got high blood pressure running in our race. We've got diabetes and all of these other ailments. A diet, you mentioned diet, that is sometimes not very healthy. And part of that is because of some impoverished areas or food deserts. They don't have fresh fruits and vegetables readily available to them and that sort of thing. So my faith also, though, tells me that God is able to do what we can't do, but we cannot tempt him by doing something outrageous. It's like walking in the middle of Broad Street and saying, I'm going to trust God not to get hit by a COTA bus. he gives us common sense and he gives us wisdom, and we have to use those things. And, there's protection in a multitude of counsel. And we're hearing a multitude of counsel tonight here on this program. And there's so many different venues where people can get educated about what they need to be doing to keep themselves safe and healthy. And I think one of the expressions of love that the Bible speaks of is your care for your neighbor, care for your brother. And if you're being reckless in your life by not doing the things that we know are working right now to mitigate some of the spread of this virus, and if we're bringing that home, if we're bringing that into our congregations, then we're not showing very much love to our fellow man. And we want to look out for our seniors. Our seniors are people who are very vulnerable. And we want to make sure that we're taking care of them. We've got several in our church, and they were the first group of people that I wanted to see get vaccinated. And we've been able to get them to vaccination sites. And they have been so grateful for that and excited about it. And their enthusiasm generates more confidence amongst others. Because if Mother Elsie got her shot and she's still here, then maybe I can too. So I think we've got to take advantage of these opportunities and use that as sort of a social gospel to spread amongst our people.
I like that social gospel. Yes, absolutely. Thank you. Mr. Cohen and Mr. Roberts, I know both of your organizations have been working hard on this very subject. I know the Urban League of Southwest Ohio has been doing its part, and I know the NAACP, Mr. Roberts, certainly has been working to help people understand, more specifically African Americans, understand the vaccine. What more can you do short of riding around with a bullhorn throughout communities to really get this message across?
Well, Marcia, I'm gonna use this opportunity to do two things, but using the bullhorn is exactly right. We had a conversation just recently to treat this like we would do a political campaign, and that would be using our vans, which is the voter action network, calling people, using the bullhorns, getting people out there. So treating this as we would a political campaign, I think is one of the tools that we will be using going forward. But I do want people to know that we do recognize there are problems. And we are working with the governor's health department, minority health task force, as well as our local health, to address those problems, because we understand registering for it is hard. And the governor has recently recognized that. And I think some of the health commissioners have recognized that as a problem. So those issues are being addressed. I think the other one that is being addressed, or we're aware of, is that when health commissioners have targeted the Black community, sometimes outside residents go into the Black community to get those shots. And we're attempting to address that as well. So I don't want the listening audience in Ohio to think we think everything is rosy and hunky-dory. We know there are problems, and we're trying to work with the Department of Health, our local health districts, to try to address those issues as well.
Yeah, thank you, President Roberts, for mentioning that. I will piggyback that, of course, the system is not perfect. We've met with some members of the governor's cabinet about how can we co-create solutions around access, around as the eligibility age decrease, that folks can take off work and that their employers will allow them to. But when people come to us, Marcia, about saying they're concerned about the vaccine, now we're not medical experts at the Urban League, but we know about engagement and activism. And when people come to you with the problem, there's usually three buckets that problem is in. Either substantively, I don't agree with something that you've done. I don't agree with who's doing it, or I don't agree how it's done. And the issue with this vaccination is we only address the substantive issue sometimes and not the how and the who, right? So when someone comes to us with some hesitancy, the first thing we do is get their information, right? And say, can I send you, when we partner with the health department and we know that we got a week, right? Can I send you some information? Can I talk to you, Miss X? Yes, to be transparency about here's what's going to happen from the moment that you get in that vaccination line to everything. So it is familiar with them. Is it a place that they are familiar with? Like, how am I going to get the vaccine? Do you need a ride from someone like the Urban League or someone that you trust like the NAACP who is next to us? And then will I check on you afterwards, right? To make sure that you're okay. So a lot of this is, you know, we think about outcomes and data and algorithms, and it's really just communicating and showing who has received it and being proximate to people who have hesitancy. And those non-traditional influencers are important, not just the Urban League, but club promoters, entrepreneurs, the people who don't have titles in our community that carry a weight and a substantive influence that can really help us expedite getting people vaccinated.
Mr. Cohen and Mr. Roberts, why has this been so difficult to move through the African-American community? When we're talking about saving lives and telling people, I want you to live, I want your family members to live, why do those words not really resonate really hard? What is it?
Well, I think as the doctors pointed out, the historical early issues were resonating with communities. But as soon as I think the vaccinations became available and people were seeing the good sides of it, you know, people were saying, well, I don't want to be first, you know, let someone else go first and then I will follow. But I think a lot of that, I think is kind of going away. And that's why we're trying to get the accessibility issue straightened out, because now that people are saying, I want it, and it's just a trust factor, Marcia. And once people say, okay, I want it, and then you spend all the time trying to get the appointment, that dilutes the trust. And so that's what we have to work on next. I think the more and more, at least I would say 50 and above, I think get it. I'm a little concerned that 50 being low, and that's why we're going to have some listening sessions with the baby boomers and 50 and lower, because they don't trust government at all. And so are they going to trust them on getting this shot? So we have to get that clear understanding and help them understand and help us understand where they're coming from. Because part of this is for us to say to them, we understand where you're at. Now let's go work on that together. So I think we know what needs to be done, but I think it's not as hard as it was. I'm hoping, at least in Ohio, I don't know what's going on in other countries. I still see bad stories about what's happening in other states. I'm sorry, but I want to talk about Ohio. So I think it's coming around, but I think the whole factor of not being able to get the shots is disconcerting. And now with the bad weather, it created some more problems for us. So that's just my thought on it.
Yeah, I agree. And I think we have to contextualize where we came from, right? When the virus first hit the States, when we were told it was not serious, that it doesn't impact young folks, and then that changed, right? And so we were bombarded with just so much misinformation, right? And then the whole mass movement became politicized. So we have to contextualize all of that, and who bore the burden of this misinformation was the African-American community. So like, first off, it is just with absolute understanding when someone addresses the vaccine is to listen, right? And if we are privileged enough to hold that agency and that one-on-one dialogue with someone who will say, I don't want to take it, you know, you may have that moment of radical transformation that Tom talked about, where someone said, okay, I'll give it a shot. But when they say, I want to give it a shot, we better make sure that we have the systems in place to be able to do it. You know, because not only do we have to do it once, you know, until we get the Johnson & Johnson vaccine, we have to do it twice, right? They got to come back for the second shot too, right? So making sure that we have a process that is not intimidated, that we describe, here's exactly what's going to happen. Here are people who you know in communities that have done it and who are fine. Would you like to talk to them? Do they have a vaccine? We had testimonials during the COVID testing, something similar. So I think we're getting there. And to Tom raises a great point of where we were even a month ago is different than where we are now. And we just have to, you know, it's one of those. Do we continue to talk about the hesitancy and give more life and energy to it? So it's a fine balance between acknowledging, yes, there's hesitancy, and also promoting the folks who have made the conversion from where they were 6 months ago till now.
Thank you both. And here's something that I'd like to present perhaps to Dr. Moore. The rumors that there are always leftover vaccines and that there are a lot of people who are able to just decide to get in on a vaccine location, a vaccination location, and just without signing up, but presenting the necessary identification and being able to get in so that the vaccines won't be wasted. Are these vaccines being wasted?
No, they're not. We've been very deliberate and intentional with not wasting. Our goal, within 24 to 48 hours of receiving our shipment, we have an appointment scheduled with a community provider. I receive information from President Cohen. I receive it from my community partners. We have been working with identifying those senior facilities where we can go in, take the vaccine in. We take a strike team with us. Within city government, what we've done is establish a wait list. So let's say I go into a senior facility, and this happened when we were working with a church. We went into the church, we were vaccinating all day, it started snowing, and we had 14 doses left at about 4:25. I received a phone call and I immediately went into action mode and reaching out to my partners, trying to get people scheduled. I got a call at 4:45 and they told me, stand down, we don't need anybody. I said, what about the vaccine? We had 14 people, and guess who got me my 14 people? It was the church. It was the church who reached out to people within that surrounding community. So first things first, we want to make sure people who are age eligible, or if they have a congenital condition, but we're not going to waste vaccine. That means I'll be calling Eddie and saying, Eddie, I need, and he's given us a list. So we look at that list and get on that phone and say, I need you to come now. And if they say, well, the roads are bad, then I'm going straight into my city team and say, okay, Director so-and-so, who you got on board? Because I know you've talked to them already. We've already talked through this plan so that we won't waste vaccine.
All right. Thank you so very much. I wanted to make sure you had an opportunity to say that despite the rumors. And one thing we want people to know, just in case there is any question, is that it's free. You don't have to pay for it. Can we establish that this evening?
Free. And this is what happens. And to Eddie's, President Cohen's process, you want to make sure you're transparent and you tell people what's up. If you come into a health center, they're going to ask you some information. This information will not be shared with the state of Ohio, just that we want to be able to bring you back. And if you have insurance coverage, we ask so that we can bill for the nurse doing the actual stick, okay? But if you say, I don't have, and you're standing in that line waiting and you think they're gonna say to you, well, you don't have insurance, you can't, that will never happen. You don't have insurance, come. You have insurance, come. Get the vaccine. You will not leave there without it. Trust me on that one. We'll get you the vaccine.
Thank you to all of you. I just want to know, does anyone have a quick 30 seconds that they'd like to wrap up anything that they felt they didn't say? I can give you about 30 seconds each, and I will be timing you. So we want to start with Pastor Revish. Is there any kind of, you know about 30 seconds, Pastor Revish? 29, 30.
I do. We violate that so often. We won't tonight.
But not tonight. Not tonight.
We can't guilt trip people into this vaccination. We can't do that. We've got to just calmly and honestly and compassionately and lovingly let them know we care enough about you that we want to see you stay here as long as God wants you to be here. So do what you can to get that vaccination.
Thank you. Doctors McDougall and Tolliver, quickly.
I just wanted to piggyback on vaccine availability. You do not need a prescription. So I want to get that out there also.
Thank you so much. Dr. Tolliver.
Yeah, so let's just talk just a little bit about vaccine side effects you can expect maybe some soreness at the injection site. When I got my first vaccination, I also had chills. I had really bad body aches. I didn't have any fevers, but I felt very fatigued. So we want to normalize vaccine side effects. So expect them, but expect them to also resolve within about 24 to 36 hours.
Thank you so much. And Mr. Cohen and Mr. Roberts, anything that you did not say this evening?
I just want to repeat, Marcia, the websites at the state and local level are good websites for good information. And you can call your local NAACP. If you don't have that number, you can call me at 1-833-OH-NAACP. That's 1-833-OH-NAACP.
All right, thank you.
Yeah, but I'll just close to just give a shout out to those who are working hard every day. I would be remiss to not lift up Commissioner Moore and the incredible job that she is doing every day to make sure that we look at this through a racially equitable lens. Folks in the governor's cabinet who are working hard at this. It's not perfect, but you have folks who are going to bat for you. I would say if you are someone who is a champion of the vaccine, then weaponize your individual influence and look at your circle and put it out there and let folks know that you believe the vaccine is safe.
Well, Eddie, I have to also thank Commissioner Mashika Williams-Roberts, my daughter-in-law, Dr. Moore. Otherwise, she's going to ask me, why didn't I recognize her? Fantastic for the Columbus.
That was good, Tom. That was good, Mr. Roberts. That was good. That was good. Commissioner Moore, can we hear from you a few seconds?
Certainly. Join us. Spread the word. Let's get vaccinated so I can go see my family, please.
Yes.
It's
Absolutely.
about seeing our loved ones. That's what we want to do. Thank you.
Thanks, everyone. This has been a great hour and a minute. I just want to say thank you to CAS, sponsors CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, the Governor's Office of Faith-Based and Community Initiatives, the Ohio Latino Affairs Commission, and the Appalachia Ohio Commission, and Live Productions for their great producing in the background there. You know, these are the folks you don't see. This is going to be re-aired on the Ohio channel this Saturday, the 27th at 6 p.m. and Sunday at 2 p.m. And all the town halls will be able to be watched on demand later at coronavirus.ohio.gov, coronavirus.ohio.gov. Also, the next town hall in the series will focus on Latina communities and will be aired live the following evening, which is Tuesday, February 23rd at 6:30. Thank you, panel, and thanks to everyone who's been watching this evening. Good night.